All right, I think we're all up here and ready to go. Thank each of you for being here on a nice, non-sunny, non-warm day. Spring is coming, and we're not over in Texas where the temperature is going to be 1 degree tonight. So thank you for coming out and being here today. We're here to talk about emergency services in northern Greenville County. If you'll think back, in 1983, there was an ER opened up by the Greenville Health System in Travelers Rest, and in the northern sector of the county, you know, you got people that live all the way to the state line, from Furman University to the state line. And it takes about 40 minutes to get an ambulance out of the city up to somebody who's in trouble. And then it takes another 40 minutes to get someone back downtown. And, you know, it's a life-threatening thing. And as many of you know, Prisma last year, when the COVID came, a lot of things changed, and they had to close the emergency room in Travelers Rest to provide for the COVID patients. And in so doing, you know, on April 5th, they announced the closure of the emergency room in Travelers Rest, and it was going to be a temporary closure. And it turned in on November 5th. They pulled the CO in, and it turned into a permanent closure. And I understand how business works. They're a private entity now, and they have to do what they have to do for the bottom line. But that created a big health care gap in northern Greenville County and left us in a situation where our residents don't have time in many instances to get downtown except for one helicopter. And one helicopter is not going to get the job done for everybody. And then once you take that $30,000 or $40,000 ride, it's a tough, you know, it's a tough situation. And so since November 5th, this team that you see up here, we've been working, trying to get different entities interested in emergency care services in northern Greenville County. And I don't want to leave somebody out, and so I want to introduce the people that are up here with me today. We have Mayor Amadon from Travelers Rest, and I noticed in the crowd, I can't see for the lights, the former mayor, Wayne McCall, is here with us today. And we got Councilman Joe Deal, Councilman Steve Shaw, Chair County Council Willis Meadows, people who always get mixed up between the two of us, Mike Barnes, B-A-R-N-E-S, Senator Tom Corbin, and Senator Dwight Loftus has been working with us. He had his sister-in-law died, and he's at a funeral down on the other part of the state. Starting from this end, Representative Patrick Haddon, longtime Chair of County Council Butch Kerbin, Chairman, House Representative and Chairman of the Greenville Delegation, Gary Smith, and our own from Travelers Rest, Lieutenant Governor Pamela Abbott. And so we're all here as part of the team today. And I am glad that you thank them for hard work, because since November 5th, we've been diligently trying to find somebody, and we've been in touch with 4 different healthcare systems trying to find someone who was interested in rural emergency services in northern Greenville County. And we have an announcement today that we have a 3-member team that is coming together, and we'll introduce them a little bit later. But we have a 3-member team that's coming together, a work coalition, to try to figure this out. And that's figure out how we're going to get doctors up there for emergency care, exactly where we're going to locate it. And once we figure those out, obviously we got to figure out how we're going to finance it. And so out of the 4 people that we have gone to, you know, we have the County of Greenville who stepped up and interested in making sure this happens. And I'm very appreciative of the County of Greenville. And in just a moment, we're going to hear from the Northern Greenville County Councilman, one of them, Joe Deal, in just a moment. Joe, you can be making your way on up here. We're going to hear from him. But we also have in the audience today, and I'd like to recognize our local partner here, and he's going to speak in just a few moments also, is Matt Caldwell, the president of Bon Secure St. Francis. Matt, thank you for being here today. Thank you for your good work. And in addition to that, we have who's just gotten up here, flown up here from the coast, from the Medical University of South Carolina. I'd like for you to welcome Matt Severance. Matt, thank you so much for being here. To go on with this coalition, what we're trying to do is put together an emergency room, freestanding emergency room. We got to go through the regulatory process and do all that. But a freestanding with some of the model services we could have with telemedicine incorporated with that in one center. And so it's a model for not only South Carolina, but it will be a model for the nation when we get all this figured out, and they're diligently working on it. And now I'd like for you to hear from Councilman Joe Deal.
Thank you, Mike. I appreciate you being the one that put all this together. We got together several months ago when the announcement was made that it was going to close the emergency room at the Greenville Hospital System. And Mike said, Joe, let's work on this. And he started working with people in Columbia, and that's why we're here today. And I want to thank all of y'all for being here and all of y'all for coming out. I represent the northern part of Greenville County. That's everything from Pickens to Spartanburg, everything from North Carolina down to Furman and over to Greer. And that's a large area. I represent the poorest of the poor and the richest of the rich. And we have needs just like everybody else. And for years, the hospital system has been trying to close our hospital in the northern part of the county. There's been committees that fought it and fought it and fought it to try to keep it alive and keep it well, because just as I said, we've got needs just like everybody else. When you have, I think Mike said something about that a while ago, could drive 40 minutes to get to Greenville to get some help. But our EMS, under our county administrator, Joe Cornell, and Dr. Blackwell, and people that run our system, they're trying to cover for the lack of emergency care in the northern part of the county. And even our fire departments are having to cover for this. But they still need to be able to have a close located facility that they can take people. We were really shocked when we heard that the Prisma health system was finally going to close the emergency room after the years of threats, and our people are very concerned. But I want to thank that we've come to thank everybody that's brought us to this collective effort of addressing this huge gap in care to our residents. Greenville County will be a partner. That's Greenville County Council and Greenville County government. We're going to be a partner with Bon Secure, St. Francis, and with the University of South Carolina to bring the emergency care back to the people in the northern part of Greenville County. And I'd like to thank y'all, all of y'all, Bon Secure and the University of South Carolina Medical, for helping us to accomplish this.
Thank you, Mr. Deal. Now I'd like to have Matt Caldwell to come up and speak just for a moment. Matt is right here. He's our local president for Bon Secure St. Francis. Matt, please take the stage and talk to us.
Thank you, Representative Burns, and thank y'all for coming. We are excited, and thank everybody, and I'd like to thank the Lieutenant Governor, who's much better looking than I am. She's been involved with our ministry for many years. Most of y'all know that Bon Secure St. Francis has had an exceptional history of quality care, really focused on what our mission is, and it's extending the healing ministry of Christ and being the hands and feet. And to that point, we look at emergency services as an outreach, and we have already started some of that downtown. Most of y'all know that we're in the midst of looking at our new ER as well, and now we're looking to North Greenville and looking to the discussions that we can have and what we can do to help the people of northern Greenville County. That is our mission, and I'm glad that we're on the very front end. There's not been any promises made or anything that has been written down about what's doing, but I believe we have the right partners at the table. And I'd like to thank Matt Severance. It took him a while to get two Matts together, and we're glad to have MUSC at the partnership as well and what we can do going forward. At the end of the day, it is about our mission, and we really do want to take care of the people that are in Greenville County and the surrounding counties. And so I thank you, Representative Burns, for inviting us to the table.
Thank you. Thank you a lot for being here today. Thank you for your good work so far. We're really excited, and now we're going to have our final speaker, and She's no stranger to any of you, but she's also the Lieutenant Governor from Travelers Rest, and she has a vested interest in what we're talking about today. Lieutenant Governor, thank you so much for being here. We'd like a few remarks from you, please. Thank you.
Thank you, Representative Burns, and thank you, everybody, for coming today. What you're witnessing behind you is what Governor McMaster talks about that makes South Carolina so different than other states. It's the communication, the cooperation, and the collaboration that's made this happen. And as you heard today, I am a proud resident of Travelers Rest and have a lot of family that is beyond Travelers Rest that this will help. Talking to some doctors this weekend who has worked at North Greenville, they were very concerned because the accidents they get there are very severe. And the fact that they would have a 40-minute to 45-minute ambulance drive to somebody that was injured and then back to the hospital would definitely be life-threatening. So as always, thank you, St. Francis, for hearing the call and having that servant's heart that you always do in helping out the community. And welcome MUSC to the upstate. And we are looking forward to seeing you around. And thank you all for coming here today.
Thank you very much. I'd like to thank each of you for coming. Thank our team for the hard work that has gone on so far. Thank MUSC and Bon Secours St. Francis.